talk about a crucial skill in mental health care, verbal de-escalation. Yes, welcome to Growth with Joyce, where the future confidence in action. When someone is experiencing intense emotions or agitation, our goal is to help them feel safe and understand. Please, have you subscribed yet? Please subscribe, like, comment. The first step is to stay calm yourself. Your composure sets the tone. Use a gentle tone of voice, maintain eye contact, and listen actively. Leave a comment if you practice this in your setting. Thank you. Acknowledging their feelings can make a huge difference in reducing tension. Focus on empathy and validation. Let the person know you hear them and respect their feelings. For example, I like you understand you are upset, or that must be hard for you. Can I help diffuse your anger? Do you like the practice? Leave a comment. Your language, non-confrontational, avoid judgments, and give them space to express themselves. This builds trust and opens the door for cooperation. Please comment, share, like the video. Conversation towards safety and solutions offer options where possible and set clear boundaries. Kindly but firmly, for example, let's take a moment to breathe. Or, am I here to help you? And I will get through this together. Remember, the goal is to de-escalate the situation without escalating it further, promoting a huge environment that supports mental wellness for everyone. I will give some of my experiences in terms of verbal de-escalation. Verbal de-escalation is a very good practice, but it has its advantages and disadvantages. The advantage is, one, you mitigate risk, because if a patient is really disturbed and you are able to verbally de-escalate the situation, you have to talk to the patient in a calmly way so that the patient can understand. However, sometimes the way we do it, when we know a patient is really disturbed, we look for somebody that his or her adrenaline has not gone up. Among the team, somebody that can calm the situation and allow the person to speak. Because if it is you that the patient has confrontation with, you will not be able to de-escalate the situation. So that is why we work as a team. You will approach the patient while other staff are there. Sometimes the patient can tell you, I don't want everybody to be here. I don't want Joyce to be here. I don't want this person to be here. You have to respect that. You respect that. And allow the four person to do the de-escalation. It might just be what the patient likes. How can I help you? What can I do for you? The patient can tell you, I need sandwiches. Then you go and give the patient. The patient will ask you for another thing again. You do the same thing, just to de-escalate the situation. Then you can ask the patient, let's say the patient is in the communal area. Would you like us to have a chat here, or you want a quiet space, or where would you want us to have the chat? In the lounge or in in the visitors room, the dining area. You mention a place that you know there's no issue with. The patient can then agree and say, okay, this is where I want it, while other staff will be there to support. But if he say doesn't want you, you don't need to be there. You can just go aside, move aside. Then sometimes the patient might not want to, so that is where it comes in. So if we are able to use verbal de-escalation, we're going to avoid risk. It helps, it's a good way for safety, because you don't have to restrain the patient, you don't have to go beyond. You just go with your words, your voice. It is a very good practice. You avoid a lot of restraints through that. You keep other patients safe, you keep staff safe, you keep the patient that is disturbed safe. So it's a very good way to use verbal de-escalation, but sometimes it doesn't work. Sometimes you will try, somebody else will try, another will try, and the patient will not want to. So, what should you do in that instance? You can get the team. We have what they call response team. They are the people that come to support if you need help. So the response team, you can get them involved, they will come. And if there are other people, one person there that can speak to the patient, then you start the verbal de-escalation. You don't rush to restraints. You talk to the patient. If that doesn't work, you can now decide you want to offer the patient some medication to calm down, or if the patient wants to stay on his own to calm down. Some of them will tell you yes, they want to stay on their own, and they will quietly walk to their rooms or wherever, garden or wherever, they will go and relax there. Some of them will tell you, give me medication. Then you give to them. Some of them will not want to accept either the verbal de-escalation medication or going to a less stimulus area. No. So in that instance, you speak to the patient and say, we need to give you some medication to calm down. Then you can do that. Some of them will tell you they are not taking oral medications. They're not going to take oral. So then you have to make a plan. You make a plan to see what they can use. Some of them will tell you it's activities that they want. Then you go for the activities. Some will tell you they want to go for a walk. Then you see how you can do that. Take them out for a walk. Medication, restraint should be the last resort. Different ways for verbal. You can talk, ask them what they need. They want activities. They want to spend time in their in a quiet space. What would they prefer? So some of them will tell you, then you go for that because that will help. So medication, restraints, they are the last resort. So verbal, use your words. If you can't, somebody else can. Look for other means. Take them for a walk. Give them something. If they want to have a shower. If they want to be involved in activities. So verbal de-escalation is a good practice. And I employ every setting to start doing it. Sometimes it's difficult, but sometimes it's good. It is a good practice. It is a best practice. Thank you so much for listening to me today. Please share the video, like the video, comment. This is the only way our community will grow. Thank you. Bye-bye. We the future, confidence in action. Thank you. Bye-bye.